This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Obrenza 100 tablet is a targeted therapy used for cancer management. It is effective in treating various forms of cancer, especially in patients with genetic mutations. Indications and uses. This medication is primarily indicated for the management of cancers arising from BRCA mutations, including ovarian cancer, breast cancer, pancreatic cancer, prostate cancer, and uterine cancer. It is particularly beneficial for maintaining cancer control after chemotherapy, reducing the risk of recurrence. How it works. By inhibiting the PARP enzyme, this therapy prevents cancer cells from repairing their damaged DNA, leading to their eventual death and making the treatment more effective. Directions for use. Patients should take the tablets exactly as prescribed by their doctor, typically twice daily. It is important to swallow the tablets whole with a glass of water, without chewing or crushing them. Maintaining a consistent schedule for dosage helps ensure the medication's effectiveness. Possible side effects. Common side effects may include nausea, vomiting, fatigue, diarrhea, and anemia. Patients are advised to seek medical attention for severe reactions like breathing problems or signs of infection. Precautions and warnings. Pregnant or breastfeeding women should avoid this medication due to potential risks to the baby. Caution is advised for individuals with liver or kidney issues, and effective birth control methods are recommended during treatment. FAQs. 1. What is Obrenza 100 tablet used for? It is used in the treatment of specific cancers, particularly in patients with BRCA mutations. 2. How does it work? It inhibits the PARP enzyme essential for cancer cells' DNA repair. 3. How should it be taken? The tablet should be taken twice daily with a glass of water, without crushing or chewing. 4. What are common side effects? Nausea, fatigue, and diarrhea are common. 5. Is it safe during pregnancy? No, it is contraindicated during pregnancy. Thank you for watching. If you have any questions or suggestions, please leave a comment below. Your feedback is valuable to us.